Good morning, everyone, and thank you for joining us today. Teresa Merintet is not in the office today, so I'll just go through quickly with the numbers that we are reporting today. We're reporting a total of 2,667 cases, an increase of 3 cases from yesterday. Of these 3 new cases, 2 of them are travel-related, 1 to the US, and another one is outside of US. And 1 is community acquired. At present, there is 1 person who is currently hospitalized. There are no long-term care home or retirement home in an outbreak. There is no workplace in outbreak. There is no school that is in outbreak. I will now move on to our epi summary. So very quickly, this is what we will try to cover, and some of the slides that you will see would be new related to school that we have added. So looking at the epi curve helps us to assess the progression of the disease, whether in the community or in an outbreak situation. And this particular epi curve is created to show the number of confirmed cases by the date it was reported to public health. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the dates these cases are reported to the public. What you will notice in this epi curve today is the timeline when each of these regions are moved into stage 2 and then moved to stage 3. What we have seen in Windsor since the beginning of the pandemic, we have seen a spike in the number of cases, and then parts of the province, when it moved to stage 2, we continue to see similar number of cases. And then when in the middle of June, most of the Windsor-Essex moved into stage 2, and then followed by the rest of the Windsor-Essex moving on to stage 2. Immediately moving into the stage 2, the entire Windsor-Essex, we've seen a surge in the number of cases, and then there was a delay in moving us to stage 3. And since we moved to stage 3, we have seen some spikes, but overall, the trend is moving in the downward direction. So focusing on the epi curve in just the last couple of months, starting from August, we're seeing an ongoing decline in the number of cases, daily cases that are reported to public health since the beginning of August. Another way to look at it is to look at the 3-day moving average, and what we can see here again is a similar picture. Some cases or some high number of cases in the month of August, and then trending it downwards into the month of September, and we're continuing to see the similar trends as we are moving into the month of October right now. This graph shows you the cumulative cases and deaths of related to COVID-19 in Windsor-Essex. What you can see is the steepness of the curve, and the steep the curve is, that means the cases are increasing at a rapid rate. But what we are seeing right now in the last couple of months, it's increasing at a very steady pace, almost giving you the impression of the flattening of the curve that we can see here. Looking at the 7-day moving average by reported date, this particular graph we created to show that the overall cases in the community as well as the community cases, excluding the agri-farm sector cases. We have seen a lot of activities in the agri-farm sectors in the month of May and June, and that is represented by the 2 different lines. So overall cases are shown in by the 7-day moving average in the blue line, and the green line shows the community cases minus the agri-farm sector, and you can see that there are significant differences in terms of those moving averages as we moved into the end of May and the month of the month of June, and we've seen some spike late July and late August even in the community cases, and then the 2 lines are merging together because those differences are pretty much non-existent right now. Looking at the Windsor-Essex weekly rate by each of the weeks, as we can see that we have seen significant increases in the middle of summer, June, July, but now we're trending downwards in with respect to the case rates by reported week. But please note that week 40 is still in progress and it ends on Sunday. So similar graph trying to compare us the weekly COVID rate with the rest of the province and with the rest of the southwestern Ontario. As we can see is our case rates remained continually high throughout the month, throughout the summer, and especially in the month of June and July. But right now we're seeing it going downwards. The Ontario rate is represented in the yellow line, and as we can see in the last 2-3 weeks, Ontario has seen a significant uptick in the number in the weekly COVID-19 rate. Overall, our Windsor-Essex rate continued to stay below the provincial average and is well below the numbers that we have seen throughout the summer. This figure looks at all the tests and unique individuals tested by week in Windsor-Essex, and in total, we have tested 105,801 tests that were completed, and out of these, 63,533 unique individuals as of September 26th. Looking at all our tests, our current person positivity is 0.6%, which is represented in the green line, and our cumulative person positivity since the beginning of the pandemic is 2.8%. Just as a reflection, because we've received this question a few times in terms of how is the testing going on in the region, and was that reflective of the number of cases that we are seeing? Because if you're seeing a low number of cases, and does that mean that the number of tests has gone down? What we are reporting is last week approximately 908 tests were completed daily, and despite that, what the numbers we have seen is pretty much encouraging for our region. This graph looks at the percentage of test results that are available within 1 day and 2 days of someone getting tested using a 7-day average. What we have seen is some ups and downs in terms of how quickly we were getting the results. Right now, what we are noticing a trend is the tests are taking longer. And in the recent week, less than 10% of the cases are being reported to us within 1 day. So it's taking us longer, and even when we're talking about the number of tests that are reported to us within 2 days, that has also gone down and close to 50% now, signaling the demands at the lab, public health lab at this time with all these tests. So we've added some new data for the community. This particular graph looks at the school absenteeism data that is reported to the health unit. When a school reports 10% or greater absenteeism, they are required under the law to report it to public health. In recent days, we have seen a number of schools in Windsor-Essex reporting absenteeism. Absenteeism is one of the many early warning indicators that we use to detect if illness is spreading in the school. It has been traditionally used for influenza surveillance, but we are also applying it to our COVID-19 surveillance as well. This figure looks at the number of students and staff that have been tested for COVID at our assessment centers, and since the beginning of the school, approximately 284 tests were completed among students and staff. Looking further at the age breakdown among students that were tested since the beginning of the school, approximately 43% of them were between the ages of 6 to 10 years, and then 34% were between the ages of 11 to 15 years. Looking at the regional and provincial rates of COVID-19 across the province, Windsor-Essex continues to have the highest rate in the province, and what we are seeing is the other regions such as Toronto and Peel that has seen a recent surge in the number of cases. They are coming closer to the case rates that we have seen in Windsor-Essex. For us here locally, as we have mentioned a few times, that the number of higher proportion of cases in the long-term care home and retirement home, and at one point it was up as high as 42% of the entire cases. Right now it is 13%, constitute 13% of our overall cases, which includes all the residents and staff. We also have seen a significant number of individuals from the agri-farm sector that were ill in our region, which constitute 45% of our overall cases. Looking at the rate per 100,000 by each of the municipality, and as we can see, Kingsville and Leamington have the highest rates in Windsor-Essex, followed by Windsor, and while the rest of the municipalities have similar number of cases across the region. This map displays the rate per 1,000 residents by dissemination area, and the areas with no colors are places where there haven't been any lab confirmed cases. Please note that the scale that we are using is 0.5 cases per 1,000 to 368.2 cases per 1,000. The scale will change in each map and is a relative comparison to the cases in each of the geographical distribution. One thing to note as these are the cases where they are living, and it's not necessarily an indicator of where these individuals acquired the cases. Simply speaking, an individual can be working in Windsor, but their home address could be in Leamington, and in this particular graph, it would be reflected the incidence rate in Leamington. This map focuses on just the city of Windsor by the rate per 1,000 resident, and once again the area with no color are where there is no lab confirmed cases. As described above the previous map, this map is comparing the cases only in Windsor, and the scale is between 0.8 cases per 1,000 to 47 cases per 1,000. Looking only at the active cases that the health unit is tracking per 1,000, and the active cases are distributed in the pockets across Windsor-Essex, and low rates are generally observed everywhere, and as you can see, the map ranges from 0.1 case per 1,000 all the way up to 6.4 case per 1,000 population. Looking further, zooming it in city of Windsor, similar picture, the scale is the same, 0.1 case per 1,000 all the way up to 6.4 cases per 1,000, and please note that these cases may have acquired outside of the area where these individuals are living. Looking at the age and sex breakdown of all residents in Windsor-Essex, there are significant differences in terms of male and female. More males were affected by COVID-19 compared to female. When we are looking at the age distribution, younger adults, as we can see, are showing up with more cases compared to the middle-aged individuals and older adults. In the last 2 weeks, the trend continues. What we are seeing is a significant number of cases were between the ages of 20 to 29, and we have seen some cases in between the 0 to 19 age range as well. So this particular graph not only focusing just on the last 2 weeks, but taking it further to August. And what we can see from August is a similar trend. Overall male-female distribution stayed the same compared to the overall pandemic versus cases from August to this point. And what we also notice is the ongoing number that we are seeing with respect to 20 and 29 years of age. That number continues to be the highest proportion of cases in the region since August. Looking at the distribution of COVID-19 cases by each of the municipality, no surprises there. Windsor, Kingsville, and Leamington constitute most of the cases, while the rest of the region are seeing minimal to few cases across. Zooming it further, in the last 30 days, more than 2/3 or close to 2/3 of cases are coming from Windsor, while we are seeing an even distribution in the rest of the municipalities. Zooming further, in the last 7 days, Windsor constitutes 3/4 of all the cases in the region, while some of the rest of the municipality, including Leamington and Kingsville, are seeing cases, and the other municipalities, Lakeshore, Tecumseh, LaSalle, and Essex, are not reporting any new case in the last 7 days. Looking at the epicurve by reported date for Windsor by each of the municipality, what we can see here is since Windsor has seen most of the cases, the epicurve can be appreciated based on the community average versus the overall moving average. And Windsor has seen some ups and downs since August. There's an uptake in the cases. Sorry, since September, there's an uptake in cases case rate in Windsor, which started to trend down, but then it's starting to pick up again. But again, focusing on just the city of Windsor, and even with low number of cases, you can see more ups and downs in these case counts. Looking specifically at Amherstburg, not many cases, and what we are seeing, the trend is pretty low with respect to number of cases in the town of Amherstburg. Looking at Essex, similar picture, slightly higher cases than the town of Amherstburg, and we can appreciate some of these moving averages with high cases around July and late July, and then starting to trend down from August, some spike in September, but then overall trending down. Kingsville has seen a fair share of cases in the region, but since August, these cases are trending down and mostly at a minimum level. Similar trend in Leamington earlier on in July, and then some early parts of August, they've seen some spike, but overall not right now, the numbers are going down. Lakeshore, similar picture, low number of cases with activities mainly late July, early August, and now trending down with few occasional spikes. Similar in LaSalle, end of August, early September, some cases, and then overall trending down. Tecumseh, low number of cases overall with few spikes, now 1 or 2 cases, which is pretty much consistent overall throughout the pandemic. This particular graph is looking at how our cases are acquired in the last couple of months, starting the month of August, while the majority of cases that we are seeing in this particular graph is green, which is as a result of close contact. But we're also seeing some cases of community transmission happening in occasional travel-related cases, mainly in the agri-farm during their quarantine period, but we are also seeing some travel-related cases in our region as people are traveling, starting to travel now. This figure shows the number of COVID-19 hospitalization and patients in the ICU on any given day. It can include both new patient and existing patient with COVID-19. Cases in the ICU have remained low for a while. In the past 2 weeks, this number has been 0. The red line indicates the 7-day moving average in the ICU, showing a decrease to 0 as well in the last 7 days. So this figure zooms in on what our COVID-related hospitalization and ICU usage looks like. We starting from the month of August all the way up to September and onwards, giving you a better picture of what is happening with respect to number of cases that are currently hospitalized. Looking at the health system capacity in general, this orange line highlights the occupancy rate of our acute care beds. The threshold is to have the occupancy rate be below 85%, which is we're just meeting right now. This signals that we may not be able to meet the demands related to COVID and could be stretched if capacity is not increased. The green and dark blue lines are for ICU capacity and ICU ventilator beds respectively. For ICU capacity, we'll look at the overall ICU capacity and ventilator beds. While there is no established threshold, we are aiming to be less than 50% for overall ICU bed capacity. Higher than this may lead to a stress to the healthcare system if COVID-19 cases start to increase in the region. So looking at where are these all cases, more than 95% of these cases in our region are currently resolved, with less than 2% or 1.5% of the cases are currently self-isolating. As I reported today, there's only one case that is currently hospitalized for COVID, and no individual is currently in ICU. We have seen, unfortunately, we have lost 2.9% of our patients to COVID-19. Looking at the age and sex breakdown of COVID-19 deaths in our community, overall, what we have noticed is more female died with COVID diagnosis compared to male. From an age distribution perspective, 66% of these deaths were in individuals who were 80 years and older. The youngest person who died in the region was a man in his 20s. This particular graph shows what it means for an individual who contracts COVID-19, and in our community, the overall case fatality rate is 2.9%. Those who are living in the long-term care home, our case fatality rate is significantly high, 15% in this group. As of September 30th, the case fatality rate in all of Ontario is 5.5%, which is higher than Windsor-Essex. In the long-term care home across Ontario, the case fatality rate is also higher compared to the Windsor-Essex. Looking at the case doubling time, our cases are doubling, taking longer to double in Windsor-Essex, which is good for our region. This means that it will take longer for our cases to double from what we've reported today. In comparison, over in Ontario and Canada, we're seeing a decrease in their doubling time. That means the cases are increasing at a rapid pace. Zooming in the last 2 months only, our day-over-day doubling time stayed consistently above the provincial and Canadian doubling time with a few dips. A reminder again, a higher doubling time means that we are doing better, and then that means there are less cases locally and there's less spread that's happening locally. The most recent estimated mean R0 is 0.44 when the R0 is less than 1. Every infection caused less than 1 new infection, signaling a decrease in the virus activity in the region. If the R0 is greater than 1, then each existing infection is causing more than 1 new cases. That means that there's an ongoing transmission happening in the community. Currently, our most recent estimated mean R0 with all these measures in place is 0.44. So in summary, overall, we are seeing low cases in Windsor-Essex, and the primary source of exposure continues to be close contact with the confirmed cases, but we are also seeing occasional community cases that are coming to our region, and also some of the travel-related cases, and not necessarily just in the migrant farm population, but also some travel related to other countries by Canadians who are going out. COVID-19 related hospitalization and ICU occupancy is low, but overall as a system, we are barely meeting the threshold that is set for to meet the surge need if it happens in the region. Day-over-day doubling time in Windsor-Essex is much better compared to the province and nationally. Overall, the R0 effective, or estimated R0 effective value is 0.44 with all these measures currently in place, indicating a decreased activity of viral transmission in Windsor-Essex. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AMA 100.
Dr. I do have a couple of questions about the presentation, but I got to ask you first, just when you woke up this morning and heard that the President of the United States is a positive for COVID, for a man that has said it's a hoax and other people support him, just with him being a confirmed case, just want to get your thoughts when you woke up this morning and you saw that.
Rob, I'll try to not to make a political statement, but what I can say is when high-profile cases like this happens, I think it should be a reminder for people to know what happens when people are not taking precautions, or what happens that with the disease on its own. I hope that it doesn't result in any significant health issue, but these are all the real things, and it's unfortunate that people still are using all these conspiracy theory to claim that it's all a hoax or it doesn't exist and it doesn't matter. And it's unfortunate that I think that despite living in this time and era, we still have to go through all of these things.
Do you think that those that call it a hoax will now see the President of the United States as a confirmed test? Are you hoping more people outside of Windsor-Essex and outside of Canada and the country take it more seriously?
Frankly speaking, Rob, I don't think that would change, because what we have seen is, doesn't matter what kind of explanation you provide to those groups, they just don't want to believe it, and there's plenty of evidence out there for them to understand and recognize that how deadly it can be. Yes, completely get it. It's not deadly for everyone, but it killed people. 76 people in our region died, and it's unfortunate that those families have to deal with all that. And it's almost disrespectful when people are saying that it's a hoax, it doesn't exist, and people are dying for other reason, and they're being labeled at COVID. It's just unfortunate. As I said earlier, I don't think that it will change their opinion, but all I can say is for people who may be buying into some of those messages, please pay attention to what is happening worldwide. It's a global pandemic. It's not something that's happening in one region, or it's not affecting just a few people. It's affecting each and everyone in the world.
Thanks for answering. I just have one quick question about your presentation before I pass it off here. But you mentioned 284 tests for students and staff. Probably tough to say, but was the health unit expecting numbers like that since the beginning of the school year, or is it hard to say?
It's hard to say. We recognize that because we're setting a high standard for all these people to be monitoring their symptoms and be mindful. So I think if they have symptoms and if they are going to get tested, I think that's a good thing that they're doing to ensure that the school and our children are safe. And hoping that as we continue to progress through this pandemic, there are some lessons that we are learning, and more specifically, as you can see, that the ministry has changed some of their screening guidelines, and we'll learn more what is working, what's not working, what are some of the changes that we need to do as a health system to meet the needs of our community, and also to address some of those real concerns that the students and the parents have and the teachers have. So we just need to work together to make sure that we're keeping our school and our children safe.
Thank you.
Any questions from the Windsor Star?
Not at the moment, thank you.
Any questions from Blackburn?
Yeah, just in regards to that new screening process and the absenteeism figures that you've been watching, do you think that'll have a big effect on, A, I guess the number of tests that are being done, and B, the absenteeism rates in the schools?
Yeah, so it's hard to say about the absenteeism particularly, but I think what we can see is some of these absenteeism could be a result of when people are becoming more aware of some of these cases, are the classes being dismissed or the cohorts being dismissed, and then as a result, they are trying to keep their children at home just to be safe. But overall, 10% is the threshold that we're using, but we also are trying to make sure that we have access to the most up-to-date information, and we're working with the school boards. So again, this is just for our purposes mainly, just to keep an eye on what the absenteeism means, and as we are trying to link those two data together with absenteeism, with the testing, and then seeing if we can develop some kind of an early warning signals for us or for the school boards to be mindful of what to come.
Well, because if test results are taking longer to come back, and these students who have been referred for testing, if they have to wait 2 to 4 days now to get their test, obviously they're going to be missing that much more school along with their siblings or parents or whoever else. That's a good point as well. So that's another thing that we'll have to mindful, but what we have to be mindful of. But what we can see is if you combine the two graphs of school absenteeism versus the lab test, so some of the absenteeism data, it doesn't align well with the lab tests that were conducted at the school setting. So maybe we need to do a little bit more analysis to explain what's going on. We have seen some lab tests that were done maybe in if you can go back to the graph, September 21st all the way up to September 24th, we have seen an uptick in the number of cases, and then we have seen some school absenteeism data starting to increase right around the 28th September mark. So there's something that's going on, but I don't have an answer to explain at this time. But we're all learning as we're going, and then when we are getting more data, we're trying to make better sense of what this data means. Thank you.
Any questions from CBC?
Not right now. Thank you so much.
Any further questions from AM 800?
I'm good, thank you. Have a good weekend.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
Sorry, just one. I realized at the beginning we didn't mention the number of active cases in the community. Has that number changed from yesterday? There was 44 yesterday, I think.
So that number has actually gone down. There's 42 cases that are currently active.
Okay, thank you.
And any further questions from CBC?
No, thank you.
Okay, thank you, everyone.
Thank you.
Thank you. Have a good weekend.